Well, hello, everyone. My name is Lisa Braddix, and I am the Chief Health Equity Officer for the Southeastern Michigan Health Association. And I am here speaking with Jimea Loveluck, who is the Health Officer for the Washtenaw County Health Department. Very glad that we can get together and have a very good discussion about everything that's going on in the health equity space for the Washtenaw County Health Department. So very, very glad to meet with you today.
Thanks, Lisa. I appreciate your time and opportunity to talk with you. Well, I'd be happy to share a bit about some of the work that we've done around health equity and how we've prioritized that in our health department. I'll just start by saying that when you look at the foundational essential public health services, the role that we have in local public health around those public health services, really equity is at the center of all that we do. And I think that it's important to recognize that public health does have a foundation in social justice and in really highlighting and supporting action to address where we see health inequities that are unjust in our communities, in our counties and state and country. For the Washtenaw County Health Department, this focus on health equity really started with our last community health assessment process, which was way back in 2015. We're now doing our new community health assessment, which of course got a little delayed because of COVID. But in our last community health assessment, we really wanted to not only bring attention to the areas in our county and the populations in which we saw greater health inequities, but really think about how we can work through community engagement and lifting community voice to work in partnership with the health department to address those health inequities. And so we identified 6 different either geographical areas or populations that we wanted to really build a partnership with at a very grassroots community level. And we created a group called Community Voices for Health Equity. And so it brings together community members, community leaders that represent those areas that work in partnership with the health department to not only look at what are some of the health priorities in those communities, where are we seeing the greatest health inequities, but really to work together to implement strategies. So we've been doing that work for many years now, as I said, since our 2015, after our 2015 community health assessment. And now as we're embarking in our new community health assessment, we are continuing to partner with this group of community members that, again, we refer to as community voices. So that's one way that we have really brought a real focus to our health equity work and work to advance addressing health inequities in Washtenaw County. The other is that we pre-COVID, we had within our health department a health equity and social justice work group. And so staff worked not only to look at issues of health equity and social justice in the communities that we serve, but also how we are building our capacity and our ability to really address those as staff of a health department in the work that we do, in the teamwork that we have, in the training that we receive. And so we went through a process where some of our leadership at the health department then developed a health equity and social justice training that was a mandatory training that all of our staff participated in. It was a year-long training process focusing on different aspects of health equity and social justice. And so that's something that we hope to reinvigorate and refresh now that we have a little more time and we're not in the midst of the COVID-19 emergency. So that's also some internal work that we've done. And then lastly, I'll just highlight that in June of 2020, our Board of Health, which is an advisory board to the health department, they're community members and representatives that are appointed by our Board of Commissioners, but they work closely with the health department in an advisory capacity. And in June of 2020, much due to the impact that we were seeing in communities of color related to COVID-19, as well as issues around police violence, we work together with our Board of Health to declare racism a public health crisis. And so also that resolution outlined both internal and external work that the health department has been doing with the Board of Health to really put legs behind what that means to declare racism a public health crisis. So those are a few things that I would highlight.
So glad that you all are hard at work addressing the inequities that are going on, particularly in Washtenaw County. And I'm glad that you really have centered things around social justice, and to the point where you have done the examination internally and taken some action there, as well as engage the community in the work as well. So very, very comprehensive work.
As a health department, and certainly in a broader goal of promoting and protecting public health for all, we recognize that while Washtenaw County overall is a very healthy county, we know that inequities do exist in our county, and it's important to not only make sure that we are bringing attention to those health inequities, but that we are convening partners across different sectors to really help us address and eliminate those inequities. And so we want to have a county where everyone has the same opportunity to achieve optimal health. And we can't do that if we are not all, given the same opportunities to be healthy. And we recognize that requires not only an attention to public health services and public health strategies, it also requires us to look at the structural factors that impact people's health, which we know goes well beyond just behavior, access to clinical care. It goes to those social determinants of health that we talk about so much in public health, and that plays such an important role in determining people's health outcomes.
Great. I'm glad that you also mentioned previously about how the Board of Health, in working with the Board of Health and in their advisory capacity and all of the things, and talking about what's going on in the community, specifically in Washtenaw County, but then also just in broader society, that everyone, you were able to name racism as a public health crisis. And I view that as kind of a success story, an example of one.
In public health, I feel like we often are very modest about the impact of the work that we do. And sometimes it's hard to also show the results all the time, because the work of public health is long-term. There are no quick fixes. We can't change health outcomes from one day to the next. But certainly it's important for us to really highlight the impact that we do have when we can. And one success, and it's top of mind right now because we just released a report today that our team put together. It's a COVID mortality report looking back at 3 years of COVID in Washtenaw County. And it's very poignant on the one hand, because we know that we lost many residents to COVID in our county. And we know that the impacts of COVID are still ongoing for many people in terms of living with that loss of loved ones, other kinds of loss and isolation that people experience during that time. So we recognize that we're still very much recovering from the impacts of COVID. Our analysis shows that in Washtenaw County, we fared much better in terms of death rate than the state on average. So if we had had the state average death rate in Washtenaw County, we would have lost almost twice as many residents. Almost 640 more residents would have died. That is our sort of preliminary analysis, and there are a lot more investigating that we need to do to kind of get to the bottom, if we can, of why that was. But certainly, I think a large part of it is because our residents were willing to get vaccinated. They were willing to follow public health guidance. And that is much of the work that not only the health department did, but we did together with many partners, including our health systems, our faith leaders, community leaders. And I think that the community engagement that we did during the response was really important to ensure that we deployed resources and services where they were needed most. And I think the other part that I would highlight is that we saw the disparity in death rate between African American residents and white residents in our county diminish over time, so that we were seeing a disparity in the African American community in terms of death rate early on. And in 2022, the death rate in comparison, if you were to compare death rate between African Americans and whites in our county, they were the same. So we really closed that gap. And again, not just because of the work of the health department, it was really a community-wide effort. It relied on all of our community-based organizations, our healthcare providers, but also our community members who helped us by following public health guidance. And so it's kind of a bittersweet report in a way, because we recognize the incredible loss and pain that we went through and that people experienced during COVID, but we also wanted to share that we were able to save lives together. And so I really think that is an incredible success.
I agree wholeheartedly. And now that you were able to see that in the data, you see it reflected all of the work and all of the collaboration that went on during that crisis moment to help save lives. It's wonderful to see that result. And I'm glad that you also pointed out about public health being quite modest and really kind of working behind the scenes. Not many people know what a health officer is or what, the health department really does, outside of maybe immunizations and things of that nature, until there's a crisis that we, like we just had. And, absolutely correct. I agree with you wholeheartedly, and also agree about the long-term nature of the work that is public health.
I hope that we will see, ongoing progress in really minimizing the health inequities that we do see. For example, again, not sure how much change we'll see in 3 years, but hopefully improvement, so that, for example, the gaps that we see in life expectancy between different racial groups, that we'll see that gap getting smaller and smaller, that we'll see improvements in infant mortality in our county, particularly given the differences that we see between our white population and African American population. So, those are all things that we certainly hope to move the needle on, and recognizing that when everyone is healthier, it really is of benefit to the whole community. And so it is in all of our interest to ensure that everyone has that opportunity to really reach their best health potential. I think the other thing is, as we look at social determinants of health and we think about those factors, those structural factors that impact health outcomes, I would also hope that we would be able to really think about policies that we have in our county, so that we're thinking about health in all policies and really thinking about how we can create more structural changes that are upstream, that really will help support people's health and really support health equity. So as we look at that, I would hope that we're going to see some movement, changes, and progress in the policy area as well.
Okay. Well, again, thank you so much for your time today, and so glad to learn more about what you all are doing for Washtenaw County residents.
Thanks, Lisa. Appreciate it. Great talking to you.